If you remember life before cell phones, you probably wonder how we ever lived without them. But these days, smartphones are playing an even more important role in our lives than just connecting with friends and family. Get this, 52% of us have downloaded health apps onto our smartphones. Not only that, 59% of us use the internet to find health information, and I'm one of those. Why? Because it's empowering. Here to tell us more is Dr. Francisco Velazquez from Pammal. Good morning, doctor.
Good morning, Olga. How are you?
I'm doing great. Thanks so much for being here.
My pleasure.
You know, I see it happening, and I know you see it too. People, you know, they question what's going on with their bodies, their children. They see a diagnosis, they look it up, they learn more. For me, it's just been more empowering to learn and know more. Do you agree?
Absolutely. I think what has happened is we have become smarter consumers, and technology has enabled that. As you mentioned, we have the internet, so 89% of all adults search the internet for healthcare information. We all have a smartphone in our pocket. 80% of the population of the world has one.
Wow.
And we have about 3,000 apps where it will allow us to track almost anything that you can think of about health, and we're using it that way. Two-thirds of Americans, roughly, of adults, are actually using their smartphones to track a health-related item, such as blood pressure, weight, nutrition, exercise, etc. So technology has enabled us to be better consumers.
And actually enabled us to ask more questions when it comes to seeing our doctor, which I think has created even a better relationship between the physician and the patient. Now, talk to me about PAML, P-A-M-L. What's that?
So PAML in the Pacific Northwest is a Pathology Associates Medical Laboratory.
Okay.
We're a healthcare solutions company with a focus in diagnostics, which basically means most of what we do is testing for cardiovascular disease, cancer, women's health, wellness. But we have other aspects of the organization. So we have a full program for wellness, and we also have a product portfolio for consumers. It's GoCinch, if you want to go and look it up, that allows people to order their own testing in the states in which that is legal.
Really? So if I wanted, for example, I'll be personal here. I'm very transparent. I'll do blood work every 6 months because, you know, I always worry about my health, and I don't know, just maybe because I'm a mom. If I wanted to get a CBC, some lab work, I could actually do that on my own without seeing my physician, because normally I have to go see him and get a prescription.
So this is where the disclaimer comes in.
Okay.
In 34 states, it is legal for a consumer to order their own laboratory work.
Really?
So there are 11 states in which there are restrictions, and then the rest of them you really can. But it's fairly simple. You go to one of the approved facilities like ours, you get online and you order specifically what you want to look for. Now I can tell you, based on our experience, that the majority of people order wellness panels, both men and women. Men a little bit older, when they push about 60, start thinking about their mortality, I guess.
Or start thinking what's going on.
One or the other, but we won't get into that. But women between 18 and 44 is where we see the most. And for women, the second most common test is thyroid function, which is very important.
So if I wanted to check my platelets, which are sometimes low, I could do that, or my cholesterol level, that's one test I could actually...
You could do cholesterol. We have a full cardiac profile, and a lot of people do it because cardiovascular disease is still the #1 issue in this country.
Yes, it is.
A lot of people want to check their thyroid. A lot of people want to just get a general assessment. I have a lot of friends, executives, that say, you know, I go in between visits. Just to make sure that I'm doing whatever my doctor told me to do.
And peace of mind at the end of the day. Stay right there, doctor, because I have a few more questions. This is really interesting. I'm telling you, every 6 months I check my platelets, white blood cell count, red blood cell count, and cholesterol. So stay tuned, because the Balancing Act will have much more on this topic. We'll be right back. Welcome back, everyone. I'm here once again with Dr. Francisco Velazquez from Pammal. Doctor, before the break, we were talking about ordering your own lab work, your own blood test. Walk me through exactly how I do it.
Sure. It's actually fairly simple.
Okay.
You can go to one of the places like ours, which is gocinch.com.
Oh, because it's a cinch?
It's a cinch.
I like
time matters. So, and you can go in, and if you're not sure what to look for, you can enter your gender and age, and it will tell you the most commonly used tests for people that gender and that age, you know, men, women of particular age. Or if you want something very specific, like most people order wellness panels.
Okay.
Or thyroid function if they're women, or cholesterol if they're men. You can go specifically and order that. It will tell you where to go and get it collected, the most convenient place, whatever that may be. And that order gets transmitted directly. You can pay online or You can pay at the collection station. Then the most important thing is the information will get back to you directly.
Oh, really? Does it go to my doctor?
Unless you want us to send it.
Unless you want it to, it comes directly to you.
It comes directly to you. And not only that, but on the website, we have a very, very good explanation of how laboratory tests work, how laboratory tests are done, and what does it mean. So it gives you a lot of information that allows you to make a decision whether that's something you need to share with your physician or not. Although we recommend that you always share that information with your primary care provider.
And just to clarify again, the insurance does not cover this. This is out of pocket.
These are all out of pocket because they were not ordered by a physician.
But they seem to be worth it. I don't think it's that pricey either.
Well, there's a range from a single test to multiple tests between $25 and $200, which is fairly cost effective compared to the traditional cost of healthcare.
And if somebody's wondering out there, okay, so what's the benefit of this when I can go to my doctor and do it? What would you say?
Well, first of all, this doesn't take the place of your doctor, so that's very important.
Totally.
But it's very useful to really monitor yourself in between doctor's visits. Or if you're not sure where you are with particular parameters, like I have to tell you, we have found people whose cholesterol was high, they didn't know it, or whose thyroid hormones were low and they didn't know that, or they had some other anomaly, and we typically call those individuals and refer them to their primary care providers. But it's good information for wellness. And occasionally, it may be more helpful than just wellness. It may direct you to pursue some action with your physician.
That you didn't know about.
That you didn't know.
Which is very important. And again, to clarify, never to replace your physician. That relationship has to always come first.
That's a very important relationship. Now, I can tell you, a lot of my friends who are executives and don't have a lot of time use their self-testing in between doctor's visits just to make sure that they're following the instructions that were given by their physician at their annual visit.
And at the end of the day, like I always tell my children, knowledge is power, and the more you know, the better off you are.
Well, most physicians will tell you that a knowledgeable patient, more importantly an engaged patient, is actually the best patient to have.
You're very engaging this morning. Thank you so much.
Thank you.
I know you're coming back to speak with Julie about heart disease and how we can find out more also through your company.
We'll be talking about that a little bit later.
Looking forward to that, and I'll definitely stay tuned for that. Doctor, thank you so much for your time.
My pleasure. Thank you.
Really appreciate it. And if you'd like more information, you can go to the website, which is gocinch.com. It's a cinch. Or you can also log on to our website. We have a link right there for you, thebalancingact.com. That's thebalancingact.com.